Dr. Singh, why do you like challenging treatments?
Challenging cases are even more gratifying but once you finally come up with a good solution. It's like solving a problem. If it's harder, you get a lot more satisfaction out of coming up with the solution. So difficult cases often challenge you to be creative, to come up with solutions, to really work with the patient to understand what they want, to understand what's possible in their situation, and to be realistic and offer them something that will work for the solution, even if it's not ideally what they were hoping for or what they thought. There's no point to giving them something that will fail. So it's working really hard with the patient to understand what their situation is and what you can get done with what parameters.